All right. Well, welcome everyone. So this is survey design, pitfalls, and pearls. The intention is a couplefold. One, we're going to give you kind of a brief overview of surveys, kind of start to prime your minds for like 10 minutes. Then we're going to break out in small groups, and we're going to apply it, because that's really it. No one wants to sit through an hour-long lecture. We want to give you some priming and have you actually apply this. And then we're going to teach back in your groups. You're actually going to teach back to us as a group, so we can all learn from the things we evolve over the course of this next 50 minutes or so. First things first, we have no financial disclosures. Really, we are invested in this room right here. You all getting better at surveys. So we can learn more, so we can get better surveys. So you can be more productive and more efficient with your surveys. Because, well, I suppose official learning objectives are, we're going to describe an evidence-based approach to survey design. We're going to outline the steps needed to provide evidence for the validity of survey evidence, and how to write survey items that have evidence-based best practices. All right, so that being said, surveys are common. Let's start with this. Who here has received a survey in their email in the past month? All right, like everyone, right? Who here has been on a listserv that's had a survey come out? All right. Who here has heard of Press Gainies? Right? Like we see this, ACGME surveys. I can keep going on. We get tons of surveys. We are recipients of surveys. Who here has done a survey, submitted in some capacity, sent down? Awesome. That's like 2/3 of the room. Surveys are very common. They're common as residency projects. They're common as medical students projects. They're common as art projects. They're common for a variety of different applications. We can use them, and we can misuse them. And the first thing is it even the right tool? When we're doing a survey, should we be using it? Think back to the last time you've done a survey and what your goal is. Because there's lots of ways to get your answer. Maybe I want to understand what the experience is of a PGY1 resident doing central lines for the first time. I could do a survey, right? I could survey all the PGY1s in my program, and I'll get a couple of short responses. If I really want to understand that lived experience, maybe a qualitative study is better. But if I want to understand something about maybe the experiences of this across maybe all of the PGY1s, across hundreds and hundreds, well, maybe a qualitative isn't. Maybe it is a survey-based model. Maybe they address different questions. If I want to understand something that they're experiencing that I can't observe, that's where surveys often is a really nice option. If it's observable, be cautious with surveys because they don't always give you the most direct data. We have poor response rates. We have issues with getting the information we actually are trying to gather. So before we even go into surveys, we always have to think about, is this the right tool? Is this going to answer the question I actually care about? Because surveys are a lot of work, right? For those who have done surveys, it's never felt like this, oh, this is so easy, right? It seemed easy. In theory, you're like, yes, this is going to be so easy. I'm just going to do a survey and I'll find it out. I don't have to enroll anyone. I don't have to get a research assistant. It's always when we work, so you have to figure out, is this the right model? And then what we're going to go into after this in a little bit is, how do we do it better? With that, I'm going to pass it along.
All right, so sometimes you have an idea that comes into your head, and you're like, I'm going to make a survey. And you start writing survey questions. And you get 20 survey questions. And you're like, oh, I should make fewer survey questions. So then you compress those into multiple questions in one question. You're like, okay, I have a 10-question survey. I'm ready to go. But before you get started, you didn't think about where you were going. So to that point about whether or not a survey is the right tool, what is your ultimate goal? What are you trying to define? What are you trying to understand? Taking a little bit of time to be more thoughtful about your roadmap and your trajectory before you write those questions is really one of the first things that you should do. So what are the constructs and what are the variables? What are the definitions of the things that you're trying to clarify? What are you trying to understand? And what are the things that you're going to be measuring? And how are you measuring them? Are you measuring them in a yes-no fashion? Are you measuring them on a spectrum? Are you trying to create a bell curve? That's the things you have to think about before you even start writing those questions. Don't forget about looking into what has been done previously. Understand what has already been published out there. So take some time, to plug in the same question that you're trying to answer. Has somebody else done that? Has somebody else done something adjacent to that? And if you're not sure how to study this, if you're kind of junior in your career and you're kind of thinking about, I don't really know how to put this together, use your resource librarians to do a thoughtful literature search, because that's going to inform the way you define your constructs and the way you calculate your variables. Now, there's a lot of talk out there about, oh, I used a validated instrument. I used a validated tool. Or if you created a brand new survey, psh, that's a terrible tool. Nobody's used that before. You can't say that that defines that. So you can borrow from something that someone else used, but you've got to think about what their constructs were. What were their variables? And are they applicable to your situation? So we recommend caution if you're using an existing tool or if you're trying to modify an existing survey tool to your problem, because it may or may not be the right choice. I know we really like this in emergency medicine, going up the steps and down the steps and up the steps and down the steps. There are a certain number of iterations that you're going to have to go through to really put together a valuable survey instrument. And so what this is going to require in some situations is it's going to require some piloting. It's going to require some revisions. It's going to potentially require some interviews. You think you write a question and it's clear in your mind. Oh, this is obvious. This is a very clear question. You give it to 5 different people, and they're like, I have no idea what you're trying to ask me here. And so getting that feedback from them and revising your question so that it's understandable to a more broad audience is part of these multiple steps and iterations that you'll need to do. How many of you have ever taken a survey that said, how many times have you not been able to connect with your patient? Or something like that. The no's and the nots and the nevers. You've seen that quite a bit. Does that hurt your brain? Because you have to think about, am I not doing this thing? Our brains use less energy when we think about things in the positive context. So the questions that you write, you should be writing them with positive language. It's much easier cognitively for us to interpret and understand questions that are written from a positive context. The other thing you want to think about is your survey should be kind of like a conversation. In some ways, you're trying to connect through this piece of paper, through this web survey, through this app. You're trying to connect with the people out there, and you're trying to understand something about those people. So if it's very stuttered and very mechanical, folks are going to disengage. They're going to stop doing your survey. They're not going to want to do what you've got in front of them. But if you make it conversational, you make it say, hey, I'm just wondering, what do you think about research in the emergency department? That's more conversational. How many patients do you think you can recruit in this survey if da-da-da? You want to make it more conversational. I warned you about this in the very beginning, so you were really excited about your idea, and you threw together a bunch of survey questions, and you're like, oh, it's too many survey questions, let's combine them. What if the answer to one of your survey questions in that double-barreled item was yes, but the answer to the other part of the question was no? Then the person who's doing your survey doesn't know how to answer that question. And you're not able to actually hone in on the thing that you're actually trying to solve. So even though it may mean that you have more questions in a survey, your data will be higher quality and will be more meaningful. All right, so how many answers do we give people? Do we give them a yes and a no and a maybe? Do we give them a yes and a no and a maybe and an other? Do we give them a Likert scale or a Likert scale, however you want to pronounce it? Do you go from 1 to 100? Do you go from 1 to 5? It goes back to what your constructs are and what your variables are and what you're trying to measure. So if you're trying to put things in 2 different categories, then you're probably going to have some sort of an even number of responses. But if you're really just trying to understand a spectrum, then you can have 5 to 7 responses because there's going to be stuff in the middle and there's going to be stuff on either side. Now, just today, I was handed a survey. And I was handed a paper survey, and then on the second page of the paper survey was a QR code. And I found myself thinking, oh, this is good. I'm giving this talk later today. Let me see if they're following the rules. So I looked at the paper survey, one page, like, okay, this is good. This is pretty simple. Just check, check, check. And then I was like, well, where do I send this? Who do I give this to? So, challenge, but I'm not here to harsh on anyone's mellow. And then I went to the QR code, and I wanted to see if the questions on the website that the QR code took me to were laid out similarly to what I saw on the page. And on my smartphone, I had to scroll really far to get from question to question. And if you're writing a survey, you may not think about that. But if you're going to use multiple different media to engage your survey takers, then see what it looks like. See what it looks like on a phone, see what it looks like on a tablet, see what it looks like on a computer, and see what it looks like on paper. And figure out whether or not you're going to be able to make it easy for your survey taker. Like, how many of you have stopped doing a survey because the format was annoying? Okay, it's important. All right, now, how do we organize our survey? What I'm talking about here with organization is where you put the questions and the types of questions that you want to know. So, how many surveys have you seen that started with demographics? The demographics are at the beginning. Unless you're doing a study on demographics, that data probably isn't that meaningful. You can put it at the end of the survey. You can put it or in the middle of the survey. If you really want some information, and it's not sensitive information, it doesn't make people uncomfortable to answer that question, like, do you eat lunch on your break? Do you take a break? Do you think people are able to answer that question? That's probably a softball. And so I'm taking that survey and I'm thinking, oh, this is going to ask me about my activities at work and my behaviors at work. This is easy. And then you save those more savory questions for in the middle of the survey, after you have established a rapport with your survey taker. They're like, oh, they gave me a couple softball questions. These are easy. And oh, let me actually think about whether or not I feel like I'm getting adequate hydration when I'm on shift. Am I drinking enough water? Am I holding my bladder until the very end of my shift? Now, I'm throwing these out as sensitive questions, but there are certainly levels of sensitivity, and there are things that you may ask your survey takers that give them pause, and they may question whether or not they want to give you that information. So if you take a little bit of time to establish survey rapport in the beginning, and then save your softball questions that you don't really need to make meaning out of your survey to the end, you're going to be in better shape.
All right. So what we're going to do is we're going to break out into, I think, 3 separate groups. And we have like about 4 cases, but I think what we'll do is have like each group tackle a different case, and then we'll report out from those. So if we could have like one group of people here in the front of this area, and then the second group could be in the back over there, and the third group there. We'll each divide up, and we'll kind of work through these small group cases and get some practical experience actually writing a brief survey. And then we're going to come back together, and we're going to talk about how we look at the validity of our survey. Okay? All right, we'll try to get moving on in the interest of time. Let's go kind of a little bit group by group. We got group 1 here. All the questions were pretty much the same with each group. What was the initial prompt that you were looking at?
We are in the process of implementing a new Getting Ready for Residency curriculum in the College of Medicine. We're looking for a way to determine ways in which the curriculum can be improved for future iterations and looking to study the effect of specific curriculum.
Gotcha.
Trying to figure out these students that are just graduating,
Yeah, you're good.
what were the thoughts in the course that we can't immediately observe just by looking at their data and academics so that we can use that to improve it for future students.
Great. What did you sort of learn in the process of this small group working in terms of the initial stages of survey design? What's your kind of takeaway from that?
Well, I don't speak for everyone, so
Sure.
someone else can join in. I would say, for me, especially constructs,
Uh-huh.
sort of think, what actually are you asking about? So we started by thinking just all sorts of questions you could ask students. But what we really want from them is insights that we can use to improve the course beyond what we already know.
Great.
So things like how they would evaluate the program from what they perceive to be true, or
Yeah.
how it actually applies to future practice.
Fantastic, excellent. And then on to the group 2 in the back there. You know, we were tackling the medical student attitudes towards emergency medicine in light of the recent match. So I guess what did we learn in the process of our small group discussions of the initial work to sort of set up a survey and sort of study that question?
I think we discussed not only what it was that we wanted to assess, but particularly who, because we were saying we don't want to necessarily assess every medical student that's out there. If there's someone that was committed from day 1 to neurosurgery, honestly, that doesn't give us that much information. But for those that were kind of waffling between and maybe chose a different specialty, that was like the high value, like target at the end of the day as we talk, think about that image of the mountain and the path to top. That was the piece of information we wanted, was for those who chose something else.
Excellent.
So that affected like how we disseminated that survey, how we set up that survey.
Right. So starting with a lot of groundwork on what our original research question is, what are we trying to actually get at, and figuring out what population we're gonna study, and then the constructs that we're gonna look at as well. Group 3, what was your prompt? What did you look through?
Don't everybody volunteer at once.
So we were asked to design a survey to better understand why faculty are not completing resident evaluations and giving feedback to residents. And this was spurred by the results of an ACGME report/survey. So it's surveys creating surveys.
Great, awesome, very Inception-like. I love it. So what did you learn, I guess, in the process of that of your small group work about survey design?
So we talked about different constructs that we would use. We talked about, what are we really trying to measure and what are our goals? And ultimately the goal is to try to get more feedback and get more resident evaluations from faculty. Then we talked about who our target audience truly is. Is it all the people on the faculty, or is it just the core faculty who are more involved in education? Is it, any schedule, or just the people that work on the shifts where the residents are? If you don't have residents overnight, maybe you wouldn't survey the nocturnist. Yeah. We talked about setting, like when would we try to administer this survey? So there was a term used that I was not familiar with called hostaging, which I thought was kind of humorous. Is like, well, you got them in the faculty meeting, so they're kind of a captive audience, I guess. So just bring out the survey right then and there. And ask everyone to fill it out before they leave. What else? We talked about format, paper versus electronic. Somebody mentioned that if you do paper, you're adding another step of data entry, which is sometimes a bit of a drag, and that you could lose some confidentiality with paper, because you kind of see who's handing it in, and you recognize their handwriting, things like that. What else? Anyone want to help me out? The other things that we talked about?
That's excellent. let's, as we've seen, kind of the process of survey design and writing survey and survey-based research is really about trying to get answers to questions that are difficult to measure in other ways. Like with our group, we talked about really if you wanted to get to this, like really actually probably would do a qualitative study. But there may be barriers which would prevent that. And so surveys can help you get at difficult to measure or challenging to measure subjects. But you really also need to talk about validity, because one of the questions you ask along the way is like, how do you know that your survey results are actually reflective of the constructs that you decided to measure or the goals and objectives of your research study? How do you know that your learners are actually, or the learners, your respondents are actually interpreting the survey items, questions in the way that you intended to? And all this speaks to basically what is the validity of your results. And when we talk about validity, there are a number of different frameworks that exist within the literature. Validity in general basically means data or evidence to support an interpretation argument for the results of an assessment. And in the meaning of a survey, that is like whether or not the survey items and responses reflect your intended construct. It's helpful to know some survey frameworks so that you can reference them as you're writing your paper, which we'll kind of talk about. But it's also helpful to know steps that you can take along the way of survey design to build that argument for validity. The classical validity framework is more historical. It viewed validity as being into three different types of validity: content, construct, and criterion. And honestly, modern interpretations just view validity as construct validity only. I'll skip over Keynes here because it's not really used within the survey literature or the education literature. MESIX is the most commonly used validity framework that's in the education literature. It's accepted by like the American Educational Research Association, the APA, and adopted by the standards for measurement in education research. It views construct validity as coming from 5 different possible sources, one being content, response process, internal structure, relationships to other variables, and evidence based on consequences of testing. Content validity in MESIX framework is basically, does that survey match the intended construct? And the way that you can build an evidence-based argument for the content validity of your survey is by doing the boots on the ground research ahead of time. It involves doing a literature search and seeing how that construct has been surveyed before. If there's a pre-existing survey instrument that's been out there, you can potentially use that again, but keeping in mind Dr. Ogle's point earlier about if you're using a pre-existing survey instrument, just because you've used one that's been published before doesn't mean that it's valid again. If you have a survey that was valid in 1950s Great Britain, it's not going to be valid in 2023. Even though it yielded valid results at that time, if you intend to use it again in a new, different population at a new point in time, you need to collect validity evidence along the way to kind of prove that it indeed is answering the questions you are posing. If you don't have a pre-existing instrument that's there, you can build a case for content validity by clearly stating in your manuscript what constructs you were looking at and mapping those to the survey items. You can use focus groups of your target population to get an understanding of what they would find to be interesting in terms of constructs. And you can use expert review of your draft items to ensure that they're matching, your survey items are matching the constructs you intended to measure. Response process validity in MESIX framework refers to what's going on in the mind of the respondent as they're filling out your survey. How are they in the moment sort of interpreting the answers that they're putting down and the questions you're asking. And you can build a case for validity through a couple different ways. One, just by adhering to the best practices approaches that Dr. Ogle had laid out in terms of formatting and survey item writing and not using double-barreled items and not using negative language and those things. If you have a much larger group that you're going to be surveying, like a national level survey, you can also use this process called cognitive interviewing, where you actually take like a focus group of individuals and you have them, you can have them sort of either through a couple different strategies, tell you how they're interpreting the survey. So there's a think aloud technique where you basically have somebody as they're filling out the survey, you say, tell me everything that's going through your mind as you're filling out this survey. And you're going to take that information, you're going to write it down, and you're going to say, okay, well, they are interpreting these questions in the way that I intended them to, or they are interpreting this in a completely different way. With a verbal probing technique, you can ask them specific questions along the way. You can have them rephrase the survey item in a different way. You can have them defend their answer. And through these strategies, you can build this sort of case for validity based on response process, because you're getting a real insight into how they are actually interpreting the survey. The internal structure is the next sort of source of validity in Messick's framework, and this refers to reliability of the response items. So, kappa, generalizability studies, Chronobox alpha, calculations that can be done. It can do some statistical methodologies called factor analysis to look and see whether or not the survey items that you have written actually correspond to the constructs. A lot of times in surveys, you might have multiple survey items which refer to a single construct, and factor analysis can help you determine whether or not all of those items actually relate to those constructs.
Can I ask you a question about that?
Please.
So this is like one. So when you're doing this, like your reliability or alignment to your construct, do you approach it sometimes in a way such that you only assess certain questions, like maybe key factors you're looking for in the survey, or is it like better practice or like better like respected if you do the whole survey? I'm just wondering, because obviously you have an onerous amount of data and doing the entire survey, is it acceptable to just make an argument for like these are the 3 key or 10 whatever to just assess those?
So it would depend on the length of the survey and how many constructs you were looking at. You want to make an argument based that for each construct basically that you're looking at, is how I would say. Pilot testing, the great advantage of pilot testing is, yes, you can do some of these factor analysis things, but you can trial out your distribution methods. You can make sure they actually work. You can trial your data collection methods and your storage methods, and you can perform some of that initial data analysis. How big of a pilot group do you need? It really depends. If you're doing a national level survey, you can afford to have a much bigger pilot group, potentially of your target population, which is nice. But if I'm just doing a curricular innovation within my residency, I can't really have a huge pilot group. It might just be a couple of individuals who I say, trial this out for me. And what I've done before as well is use like a parallel group. So if I'm surveying 1s and 4s, I might use my 3rd-year residents or 2nd-year residents as my pilot group. The fourth source of validity is this relationships to other variables, and this is basically seeing how your survey responses, whether they relate or they correspond to known external variables. So for instance, if I were surveying residents on their perceived comfort performing intubations, I would expect higher levels of comfort to be associated with higher PGY levels. And so if I see that correlation, I can report that, and I report that as something that sort of lends credence to the validity of my results. The final source is this consequential validity, which is not often reported within the literature because it actually takes some downstream like data collection and thought to really capture. But there is this concept within the psychology literature of this mirror measurements effect, where the mirror measurement of something can result in affective or behavioral changes in the future. So it's important to kind of think about your survey and how it may change your respondents. So for instance, if I were surveying a group of residents on wellness and burnout on a Q6-month type basis, like that might actually improve attitudes because maybe they say, oh, well, they're listening, like they see it's a problem, they're listening to me, that's very important. Or maybe it could actually worsen attitudes because they're having to continually reflect on the fact that they're having sensations of burnout. So the final process really is to report your literature, report your findings. So there's a couple different recommendations or papers out there that sort of outline best practices for reporting survey-based research. One is this CROSS study, which has it was a modified Delphi process. They have 19 items and sub-items. It does not emphasize a framework-based validity argument, but it does have a very detailed, like section by section sort of instruction on what to include in your paper. The academic medicine guidelines do have a sort of an emphasis on presenting a framework-based validity argument as you are reporting your study results. And I actually think it's a little bit more streamlined than the cross guidelines because it doesn't include a lot of items that are really perfunctory and can be included really with any research study. And so it breaks down sort of what you should do in your introduction section, what you should do in your methods, and what you should do in your results. So that brings us to the end. I appreciate your all's time and efforts in the small group cases. We only have a couple minutes left, but any questions for myself or Dr. Ogle in terms of survey design? We're happy to take them here or later up front.
If y'all want to do a deep dive, we have copies of some articles over here for you.
Great. You got a thumbs up in the back? That must be good.